Hello, I'm Jean Pete, and I welcome you back to our show, Better Living. Better Living is brought to you by the Homestead Hope Foundation and is sponsored by Homestead Hospice, where commitment to education and premier hospice care helps patients and families through life's most important journey. Thank you for joining us again today. I'm here with Dr. Saju Matthew from Wellstreet Clinics, and we have a lot we're going to talk about today, so I'm very excited again about the show this week. Dr. Matthew is going to talk to you about Wellstreet Clinics and urgent care, but we're going to talk also about some important information about diabetes, hypertension, obesity, preventative care, keeping you healthy through this long winter season, and also mental health with everything that's going on in the news and the sad tragedy in Newtown, Connecticut. We wanted to talk a little bit about depression and anxiety and what to look for and how your primary care physician and urgent care clinics can help you identify if you might need help or someone you know might need help. So, Dr. Matthew, I'm very excited to have you on the show today. Very important information to be discussing with our audiences.
Well, thank you, Jeannie, for having me on the show. I'm excited
Why don't
to be
we
here.
start? Oh, thanks. Why don't we start with, I didn't mean to cut you off there.
No problem.
I'm excited.
I'm used to
that. And speaking of preventative care and healthy living, I've got my energy drink right here.
Nice.
So clearly I didn't need as much of it before the show. But why don't we start by telling the audience about your background, how you got involved in primary care, and then moved into the urgent care setting.
Okay, well, thank you. So, yes, I am a primary care physician, board certified in family medicine. I've been a primary care physician in Atlanta for about 10 years. And I started working in primary care with a passion for prevention and, acute episodic illnesses, and then switched to urgent care about 5 years ago, and I've really never looked back. But I'm still a board certified primary care physician working in an urgent care setting.
So when you say acute episodic illnesses, I'm assuming that's what kind of pushed you into primary care, but what would you categorize as an acute episodic illness?
Yeah, it's a good question. So basically, we can categorize patient visits into two separate categories. I've got a cold, I need to see a doctor now, or I've had high blood pressure for 10 years, I've got to make sure my blood pressure is under control. So the former would be, seeing a physician immediately to take care of a sinus infection, a headache, versus chronic illnesses like diabetes or high blood pressure, where patients end up seeing their primary care physician.
Let's talk about high blood pressure. You hear a lot about diabetes, but I think there's some precursors to diabetes, and there's precursors to heart disease and precursors to everything out there.
Absolutely.
And you hear about high blood pressure a lot, and, as a woman in midlife, it seems like more and more people I know are now having blood pressure problems all of a sudden. So can we talk about high blood pressure? What causes it? Is this something that at a certain age you're more at risk for? What can you do to prevent getting it once you have it? All those questions we're going to move forward on.
Absolutely. Do you have an hour?
No.
So I'll try to be very concise. High blood pressure, unfortunately, doesn't have a lot of signs and symptoms. So I hear tons of friends at parties saying, hey, Dr. Matthew, so I only need to see a physician if I have a headache, right? Or if I'm fatigued. And the answer to that is absolutely not. I tell all my friends, my patients, keep an eye on your blood pressure, even if you don't have a family history of high blood pressure or a personal history of elevated blood pressures. And the reason for that is unless your blood pressures get really, really high, and we're talking about above maybe 170, which is the top number, and the bottom number being above 110, you're not going to necessarily have signs and symptoms of high blood pressure. So the question is, how do I know if I have high blood pressure? Well, I think everybody should purchase a machine. You can walk into Sports Authority, get a machine, make sure that the cuff fits you correctly, and check your blood pressures in the morning before you have coffee, and then maybe before you go to bed at night.
So everybody midlife and up?
Absolutely. I would say if you have a family history of high blood pressure, dad, mom, brothers or sisters with high blood pressure, it doesn't matter what age, you should be more alert to your blood pressure.
'Cause I don't know too many people that have a have a blood pressure machine.
You got it. That's exactly right. Or what happens, Jeannie, is they walk into a pharmacy. Oh, I'm here to pick up some Powerade. Let me just go and put my arm into this machine and see if my blood pressure is right.
And I think that would happen more than people probably buying one, but it is important to check it.
Yes.
Okay.
It is very important to check it because high blood pressure is really a range, just like normal blood pressure is a range. It could be anywhere from 90/60, which is fairly low, to less than 140/90. That's considered normal.
Less than 140 over between 70 and 90, that's normal?
Yeah, so basically to
Okay.
make it simpler, less than 140/90 consistently, you probably don't have high blood pressure.
You're
But as
good.
you get closer to the 140/90, you have elevated blood pressure. And that's really when you really should check your blood pressures, maybe even keep a log. Then the next time you see your doctor or your urgent care physician, say, hey, listen, doctor, these are my blood pressures. And it really helps the physician because that whole white coat syndrome does tend to be an issue when you see a physician.
What do you mean white coat syndrome?
Meaning you walk into the doctor's office, you're a bit anxious, just like me. You know, you fought traffic this morning to get here.
Yeah, I'm sure your blood pressure was
My
up.
blood pressure was a bit high, yeah. So that is not necessarily an accurate measurement.
Right.
But giving a physician a log
Okay.
of the blood pressures you took in the privacy of your home when you were relaxed tends to be more accurate.
Okay. And we're talking a lot about high blood pressure, and there's a good reason for that.
Mm-hmm.
And so if you're in the 140 to 90 range, you're really borderline high.
Yes.
And so you're at risk because you're borderline high, or if you're over that, to get lots of other diseases.
Absolutely right on.
Which would be?
So if your blood pressure is high, you can get a number of illnesses, anywhere from headaches, patients who have migraine headaches all of a sudden start getting more migraine headaches. If you have elevated blood pressure, you're at increased risk for cardiovascular disease, having a stroke, having a heart attack, being fatigued, many other chronic illnesses. So your blood pressure really needs to be under good control. It's like the thermostat of your body.
Is there a, what would a blood pressure be if someone was at risk to have a stroke? Would it be 140/90, or would it normally be higher than that?
It would be higher, yeah. So remember...
What's the risk parameter for stroke occurring?
Yeah, so I mean, it's difficult to attach a specific number because it's really looking at the overall patient, the signs and symptoms. But blood pressures that are consistently high, above 160, which is pretty high, the top number, and the bottom number above 120, really puts you at increased risk for a heart attack and a stroke.
And is it the bottom number that's the biggest worry, or is it both in conjunction
both
with
numbers.
each other?
Yeah, the top number is called the systolic, the bottom number is called the diastolic. And we pay attention to both numbers. They're both equally important.
And the reason I'm harping so much on blood pressure is because we're going to talk about preventative medicine as well. As you are in the urgent care clinic, there's a lot that people can do so they don't end up in the urgent care clinic.
Absolutely.
Or in the ER. But, maybe it's my age, but I'm just hearing more and more people, oh, he had a heart attack, or she had a stroke, or she's in the hospital because her blood pressure's through the roof, and they're worried that she's going to have a heart attack or a stroke. And, I feel young.
You are young.
I don't feel like these folks should be at risk. But, you get in your 40s and 50s, and this is a show geared towards seniors. So then you talk about 60s, 70s, 80s. This is scary stuff. We have got to take care of ourselves, and we have got to know our bodies.
Absolutely.
And I don't think enough of us are aware. I think you do as you get older, but not as aware in your 40s and 50s and 60s as you should be.
Absolutely.
So monitoring your blood pressure, and if it does get in that 140 to 90 range, what happens then?
So then you've checked your blood pressures, and over the last maybe month or so, you've noticed that your blood pressures are sort of bouncing around, but hovering around 140/90, maybe even 150/100. It's time to make an appointment, even if you don't have symptoms. So that's what I really want to make clear to our listeners is don't wait until you have symptoms, because then it's probably going to be really high and you're at a much higher risk of these illnesses that we talked about. So call your primary care. call your physician at Wellstreet. Doesn't matter where you go. See a physician and find out what the next step is, which really ends up being the physician talking to the patient, assessing your risk factors, some blood work, maybe even starting you on a blood pressure medicine.
And I want to back up just a minute because I know, even myself, I have a headache, I'm tired, oh, Jeannie, suck it up, take some Motrin, get on, go to work, forget about it. The busier you are, the less you'll think of what's going on, right? So we know that if you have high blood pressure, you might not have any symptoms, but you might also have a headache, you might be very tired, and you're at risk now for stroke and heart attack. What happens in the body? You know, let's talk about what is it that leaving high blood pressure untreated for a long time, why does that cause a likelihood of stroke and heart attack? What is that doing to the inside of your body so that people, what I want to do is I want to motivate people that even if you don't feel like you're that sick, this is what's happening inside your body, so pay attention.
Yeah, very good question. So I think an analogy would be to look at the blood vessels in the body like pipes, like maybe, like a water hose. So we're going about our daily activities. We're all busy. We have little time for taking care of ourselves. And slowly what's happening is just like the water in a hose, the pressure is increasing gradually. But, the body is amazing. The body will adjust. So over time, your body starts to get used to higher blood pressures. But that's not necessarily a good thing because at some point when the pressure in that hose gets too high, the hose will pop. It'll break open. And that's what we really should visualize happening in our bodies is when the blood pressure is high, the pressure has gone from a normal range to a higher range, and it's putting a lot of force on the inside of our blood vessels. So you can imagine the shearing forces from turbulence, if you will. Which can cause the blood vessel to pop open, causing a stroke, which is basically a leakage of blood in the brain, very dangerous. Or it can put increased pressure in the blood vessel supplying your heart, causing a heart attack.
And that is a burst blood vessel in your heart.
Yes. So a burst blood vessel in your heart.
Or a leakage.
To put simplistically, or a leakage in your brain.
I like simplistic.
Yes.
Because not everybody is a doctor or in the healthcare industry.
Yes.
So while I might know a little more than I come on knowing, I like to simplify everything. And I can visualize that.
Yes.
That would prompt me, hey, look, my blood pressure's high. I better watch this versus toughen up, like I think so many of us have been pre-conditioned to do, and just keep on going.
Yep.
It's too important, folks. It's too important. And I think in your 40s and 50s is when you're at the highest risk
Absolutely.
Of having a heart attack.
You got it.
And most often, you're not just going to have a heart attack. It's going to be because you've had that high blood pressure that you haven't been recognizing.
Absolutely.
You might not have had symptoms.
Yep. I have friends, Jeannie, that are in their early 40s that have always worked out, but never really seen a physician.
Yeah.
These are guys that look younger than their 40s. They look like they're in their 30s. They're playing tennis. They're working out consistently, but they've never had their cholesterol checked. They've never had their fasting blood sugar checked. They've never seen a physician in 5 to 7 years. Why? They feel great. So I think that's a really important message is even if you feel fine, shake a primary care physician's hand once a year. That's all I ask our listeners. Once a year, suck it up, make an appointment. It's just 1 hour, of your time that day, and get a physical. The physical can reveal so much important information.
And especially if you have a history. If someone in your family died of a heart attack, I mean, I know this too. You see men and they're worried because maybe their father or their grandfather or their uncle died of a heart attack in their 50s.
Yeah.
And I see this because I know quite a few. And they worry, I don't know if I'm going to live past my 50s. Well, then those are the folks that should have a blood pressure cuff at home and checking their blood pressure regularly and writing it down and monitoring it and getting to the doctor if it's at that 140/90 range too long. Let's talk about cholesterol and fasting blood pressure, though.
Okay.
What are we looking at in terms of cholesterol?
Right. So every year above the age of 40, again, this is assuming that you don't have a family history of high cholesterol. If you do, see the doctor sooner. It doesn't matter. You're never too early to get a physical. You can get a physical at 25. But typically, I tend to see patients in their 40s and higher. So you come in, very important when you make that visit to see your primary care physician, that you go in fasting. See if you can get an appointment in the morning. That way, you don't have to fast for more than 12 hours. And when I say fast, a true fast would be from midnight on the night before. You have nothing to eat or drink. You can have black coffee or water, but nothing else. Show up at your doctor's office, get that physical, get the blood work. And I really stress the fasting because when you fast, it's a way accurate measurement of your cholesterol. Not just your total. Everybody knows your total. The total number is not an accurate representation of your good cholesterol, which is called HDL, your bad cholesterol, basically, which is your LDL and your triglycerides. It's also important to fast to check your sugar. A fasting blood sugar is way more accurate than someone who stopped by, maybe Starbucks, and got a nice latte and then shows up at the doctor's office loaded. Yeah. And then says, hey, I'm here for my physical, So it's very important to remember to maybe forget some of your breakfast routines when you see that physician for a physical.
Very good information. So let's talk about the good and the bad.
Yeah.
What do you want your HDL to be, which is your good cholesterol? And what do you want your LDL triglycerides to be, which is the bad cholesterol you want to stay away from?
Very good question. So basically your good cholesterol is called your high density lipoprotein, which is your HDL. You want your HDL in women to really be above 50 and in men to be above 40. Just a rough measurement. Cardiologists listening to me, forgive me. I know I'm making this very, very simplistic, but once
we're
again,
helping.
We're helping, right?
Yes.
We're trying to get patients to understand basic information from which they can build on. So women, higher HDLs are expected than men, and the reason for that is women have estrogen and men don't have estrogen. Well, not as much, right? Okay. So that's the breakdown of cholesterol. Now, in terms of bad cholesterol, you really want your LDL below 150 and your triglycerides really below 150. Once again, I've got to say this as a physician, it also depends on your risk factors. If you're a diabetic, we tend to be more strict. If you have high blood pressure, we tend to be more strict with those numbers. But if you're a relatively healthy 40-year-old or 30-year-old, those would be good numbers to look for.
This is a terrible question for me to ask you, but I'm going to ask it anyway.
Yeah.
Or maybe it's a great question. If we had more people checking their blood pressure and more aware of their cholesterol numbers, how many heart attacks and strokes do you think that we could prevent on a percentage basis?
That's a great question, Jeannie. In fact, it's a really good question because there is a statistical definition for that terminology, and that's numbers to treat. How many numbers of patients with high cholesterols and high blood pressure would you have to treat to prevent like 10 heart attacks? It's difficult for me to quote numbers, but it's a high number because at the end of the day, we're talking about minimizing our risks in life, right? You do that on a daily basis. If you fly and if you drive, you're always looking at how do I minimize my risk for not having a car accident, a plane accident. We think about those things casually, Same thing we should think about, with our bodies. How do I minimize my risk for dying from a heart attack or dying from cancer and various illnesses?
Well, that too, yeah. We're talking about heart disease, but really it's a lot of illnesses because of the way you treat your body.
Absolutely. Right. So I guess basically to answer your very good question in a very simplistic way, it's a huge number. It's I would say over 50-60% of heart attacks, bad events can be prevented if you are truly at increased risk and you're not seeing a physician to get any help. So
I want to stress that because we are in control.
Yes.
I think a lot of people think, well, I have a history, I'm going to the doctor, I'm getting it checked, but you really need to be on top of your numbers. You need to be checking it constantly, and then you can get to the doctor quicker and prevent that heart attack from happening and get on medication.
Yeah.
Okay, so we are in control, folks. If you have not seen your doctor in the last year, I implore you to please go and see your doctor. If you walk into a local pharmacy, it's this time of year with the holidays coming, you're going to get gifts or whatever, you're running crazy. When you're there, just get your blood pressure checked. They all have those cuffs in there now. And take your own health into your own hands. Okay, so we've talked a lot about stroke risk and heart attack. Being fatigued, that worries me because that's a huge sign that something's going on with the blood circulation, right? And the pressure. How does that all connect?
So basically, when you have high blood pressure, it puts more stress on the body. And we all know as Americans what stress can do to our lifestyles, how it can affect our job, our relationships. It's the same thing with the body. At some point, the body just stops being able to compensate for high blood pressures and increased stress, and it manifests itself in terms of just feeling tired.
And so that's a sign, folks. You know, it's a busy time of year and we're running crazy. You know, every time of year is a busy time of year. And you may just write it off. Well, I'm just tired. I'm busy. I need to slow down. But if you're really fatigued, and a lot of times that happens like after you eat, not a lot, and then you want to go take a nap or go to sleep. It's not just an age thing.
That's right.
You need to really be paying attention to that. If you're tired every time you eat, that's a big sign.
Absolutely. Yeah.
And so please go and take care of your health and get checked and get on the proper medication, because the medication will lower that blood pressure and keep all that buildup from happening.
Absolutely. Yep. Okay.
We have so much to talk about. And I do know you're here from Wellstreet Clinics, so I want to talk a little bit about Wellstreet Clinics, and maybe if you could shout a number out to our audiences if they need urgent care, if they're really feeling yucky, if they need, if something acute is happening and they need to get to the urgent care center. Now, we've talked a lot about heart disease and stroke. That's not something you go to an urgent care center for. You go straight to the hospital for that, right?
Well, not necessarily, Jeannie, because just so that our listeners understand, yes, an urgent care is definitely not an emergency room.
Okay.
At Wellstreet, every one of our physicians are board certified primary care physicians. We see tons of chest pain. We're very comfortable with chest pain, shortness of breath, someone who might be having a blood clot that comes in, absolutely cannot talk, cannot breathe. These patients show up at urgent cares. So we can take care of those issues as well.
Okay, and that's not true for all urgent care centers, but because you're at Wellstreet, I know because I've interviewed Dr. Resnick before, you are all board-certified physicians.
Yes, ma'am.
And so you know if you go to a Wellstreet Urgent Care clinic, you're going to be taken care of by a physician.
Qualified physician, yes.
Can you give us a phone number if someone wants to call and get more information about Wellstreet?
Yeah, well, actually even do better than that. I'll share our website address, which is wellstreet.com. And the reason why I say that is because we have 9 different locations, and our patients should just get on the website and find out the location closest to them. You know, since they're 9, there's pretty much a Wellstreet in your backyard. I mean, that's how we have really multiplied in the Atlanta market. So it's wellstreet.com.
Great. And there's so much more to talk about. And I know we've talked a lot about preventative and getting checked and all of that important information. And they can come to the urgent care clinic and see you, and you work in conjunction with their primary care physician to get them the best care possible.
Absolutely.
We do have to go to a break, but we have so much more to talk about. And I want to pull the pieces of this puzzle together to explain to folks how important you are as a place to go in an acute situation, and how well you work with the primary care physician to have that coordination of care. And then we're also going to talk about hypertension, obesity, other ways that you can be in control of your own health. So stay with us. We have to take a quick break. Hello, I'm Jean Pete, and I welcome you back to our show, Better Living. Better Living is brought to you by the Homestead Hope Foundation and is sponsored by Homestead Hospice, where commitment to education and premier hospice care helps patients and families through life's most important journey. Thanks for staying with us. I'm here again with Dr. Saju Matthew with Wellstreet Urgent Care Clinics. And before the break, we talked a little bit, we ran out of time, so we talked a little bit about urgent care clinics and acute illnesses and why people might go to the urgent care clinic. And we were talking a lot about high blood pressure and cholesterol and how important it is to know your numbers and to take care of yourself and get to the doctor so that you can prevent high blood pressure and prevent a higher risk of getting a stroke or a heart attack. I wasn't aware that if someone had chest pain, you could go to an urgent care clinic. That would scare me. I probably would have sent someone to an ER. So before we get into all of the other things that we want to talk about, hypertension and obesity and preventative care and how your urgent care clinic helps, let's talk about how you can help. I want to get more deeper into it's okay. And sometimes it might be better to go to the urgent care clinic because maybe you're a lot closer to that patient.
Absolutely.
So let's talk a little bit more about that. I don't want to leave that unanswered.
Okay. Thank you, Jeannie, and you hit it right on the nail. So, it's tough. When you're in a situation, you're driving from the mall, you're driving from work, all of a sudden you have chest pain. You're able to still drive, you're coherent, you can get on the phone, you can talk to a friend, you can get help. Well, our instinct is to pull into the closest facility. We don't necessarily know the Northside ER is 10 miles south. You're just trying to get some help. So urgent cares are popping left and right in Atlanta. Obviously, I work for Wellstreet, so I think we're the best in Atlanta. Pull into an urgent care facility. You can, if that is the closest facility on your way. And remember, if it's after 5 o'clock, a lot of the primary care offices are closed. There's no point even calling a primary care office if at 6 o'clock you need some help.
That's so important. And what are the hours of typical urgent care? I know you all are usually open later than most.
Yes, we're open from 9 a.m. to 9 p.m. every single day of the year. We don't close for holidays. We do not close on weekends. Moms and dads listening, you would love our urgent care because your child, your daughter doesn't need to suffer through sore throat and a sinus infection all weekend. You can come and see us. So sorry to digress from
no, that's important.
Basically what happens. But
and if you're getting chest pains after hours, you might think, well, I can talk. I'll just suffer through the night and I'll go and see the doctor in the morning. Not a good idea.
You got it. Not a good idea. And Jeannie, this is a 4-hour lecture in medical school, but chest pain, all chest pain doesn't necessarily mean that you're having a heart attack, right? It could be anxiety. It could be asthma. It could be something bad like a blood clot, which is not a heart attack. It could be that your muscles and your bones in your chest area are inflamed and sore because you worked out. You had a softball intense practice 2 days ago and you forgot about that. And now every time you breathe, your chest hurts. Regardless, though, chest pain is taken very seriously. So instead of thinking heart attack first, think, I've got chest pain. I need to find out why. An urgent care like Wellstreet would be an absolutely good initial point to evaluate for a lot of reasons. Number one, we are definitely not as busy as the ER. At Wellstreet, we take pride in getting patients in and out under 45 minutes. Sometimes
I love that.
There's no wait. So you walk in, you're seen immediately by a board-certified physician. We do an EKG. We can stabilize you. If we think that you need more care, more emergent care, the ambulance is there in under 2 minutes. We give them an envelope with all your labs, your EKG. We call the ER physician, sometimes even on their cell phone directly.
And then they're taken quicker when they get to the ER.
Absolutely. So you've saved 4.5 hours of wait time. You're now into the ER quicker if you need to be.
And if by chance it's very serious, you've got a doctor right there treating you.
Absolutely.
Great.
And on the flip side of it, Jeannie, if it's just from reflux or if it's what we call costochondritis, which is an inflammation of the rib cage, we can treat that and send you home. You're at home having dinner at 9 instead of coming home at 2 o'clock in the morning because you went to the ER and you waited. Now, I'm not at all saying that the ER doesn't have a place for our sick patients. But if you look at statistics, 50 to 60% of patients that go to the ER do not need to be in the ER. They can be seen at an urgent care.
This is just so important to me because I guess it is my age, like I said before, but the scariest thing is to think someone's just going to go of a heart attack when you least expect it. And so if you do have chest pain, don't write it off.
Right.
And a lot of people do. You know, we're such a tough, we're busy and we don't want to, I guess we're a society in denial maybe. I don't know if we're all that tough, but we don't pay attention to our bodies.
That's the key word. You mentioned awareness at the beginning of the show. That is so key. Being aware of your body and saying something is wrong. Let me just check it out. And oh my God, I've got to go to the ER now and wait 6 hours. Not anymore. That's the beauty of an urgent care. Walk into an urgent care.
And women, I know this always lays on us. I'm sorry, Dr. Matthew.
Okay.
But I know a couple of men, and they're not going to take themselves to the clinic. Yeah. So you have to sometimes be pushy and put your foot down because it's worth it. And let's talk too about the chest pain. If it's coming and going and coming and going, does that happen a lot, or is it something that's just going to come and you're going to end up having a heart attack? Are there precursors to a heart attack?
Sure.
I think a lot of people think it just happens out of the blue.
Yeah. So again, a very good question for an answer that could take me 2 hours. So
I'm good at that, aren't I?
You're very good at that, Jeannie. So let's see. Let me try to sort of simplify it. Chest pain, depending on what you're experiencing, can have different signs and symptoms. So for a lot of our female listeners out there, young females, middle-aged females on birth control pills, if you should have chest pain and you're having difficulty walking up a flight of stairs, or you're in great shape, you've been running on the treadmill every evening, and now you just feel like it's tough to get that 1 mile in. You never know. Just listen to me. I'm not saying you have this. It might be a blood clot. I've diagnosed so many young women on birth control pills who have ignored that shortness of breath. And sometimes they can have chest pain as well. So that's why I brought that up. In those situations, the chest pain can come and go. You're short of breath with activity. When you're at rest, you may not feel it.
Okay.
A person having a heart attack, we've all seen this, in movies and read articles about this. It's typically pressure. Dr. Matthew, I feel like an elephant is sitting on my chest. I cannot get this elephant off my chest. It's very different when a patient says that versus every time I take in a deep breath, it hurts, or when I touch my chest, it's very tender. So I don't want our listeners to feel like they have to diagnose themselves. So that's also important to let our listeners know. But the moral of the story is, depending on what you're experiencing, the chest pain can come and go. The chest pain can last for just 30 seconds and you may not experience it again. But if you feel like an elephant is sitting on you, you're nauseous, you're vomiting, dangerous, absolutely needs to be seen. But once again, I can't stress this enough. The two words that scare a physician more than anything else are the words chest and pain in the same sentence.
Right.
We take it very seriously.
Right. And it doesn't matter if it's on the left or the right, because I think people think if it's the left side, I got to worry. But if it's the right side, it's probably a pulled muscle.
Yeah. See, chest pain.
Okay.
Still needs to be evaluated. Hey, if the physician can console you and send you home, great. If the physician at Wellstreet or an urgent care thinks that you need further evaluation, then you should get further evaluation.
And honestly, a trip to the urgent care clinic, it's not as much as going to the ER room.
Absolutely.
Right? It's a little bit more than the primary care physician visit, but a lot less than an ER visit.
Very well put. That's exactly right.
Okay.
So if your copay at your primary care is $25, ours might be $35, $40. ERs can be $150, $200, not to mention, and again, to all my ER physicians out there, they know this, we have this discussion all the time. An ER physician is trained very differently from a primary care physician or an urgent care physician. An ER physician wants to make sure that nothing is missed because they may not see you ever again. So what ends up happening is the investigation into your problem can be a very prolonged and long investigation. I'm not saying that that's not necessary. I'm saying for a young patient or even an older patient that has chest pain from reflux, doesn't need to get that entire investigation, full workup. You got it. So once again, have it evaluated and the physician will direct you to the right place. Very,
very good information. So we've talked a lot about that. I want to kind of move on to other topics here. But thank you so much for taking the time, because I worry a lot about what I'm seeing at my age. And, we've done a couple of shows with physicians, but I don't think we've ever really gotten to the bottom of the simple things people can do to help take control, especially, you said even if they don't have, especially if they don't have a history, but if you do have a history, really you're negligent. To your family.
Good word.
If you are not taking control and monitoring your numbers and going to the doctor. Don't be the tough guy or the tough mom who's too busy to take care of herself because she's busy taking care of everybody else. If you're gone, no one's going to be able to take care of them the way you take care of them. It's well worth the $40 visit to the urgent care clinic, which is dinner with your 2 kids at some, middle of the road restaurant. No big deal. And you're here for a long time. So let's talk a little bit about hypertension and how that can affect folks as well.
Okay. So, elevated blood pressure, we talked about keeping a log of your blood pressure readings, presenting to the doctor's office and figuring out, do I need to be on a blood pressure medicine or not? And my dear listeners, please do not fight getting on a blood pressure medicine. If you need a blood pressure medicine, it's probably the best thing that the doctor ever said to you, because that means we have identified the problem and here's a solution to the problem.
Why do people fight getting on a blood pressure medicine?
Just don't want to take a medicine. The thought of, I've got to take a medicine every day, just sort of, I think it kind of eats up the inside of you, thinking, you're either getting old or you can do it on your own. Boy, if I just hit that gym, oh, Dr. Matthew, I promise I will lose 30 pounds. When I see you next, my blood pressure will be fine. And I'm like, you know what? I'm great. I'm happy that you're motivated about exercise. Do it all together. Get on a blood pressure medicine, hit that gym, watch your weight, eat 6 small meals a day, and let's try to really minimize your risk.
And because we want to see you get old. If your biggest problem is I'm getting old, I don't want to take this medicine, good for you.
Yeah.
Because we want you on the medicine and we want you to get old.
Absolutely. We take a vitamin every day.
Right.
And we don't think about that. Why can't we take a blood pressure medicine that's going to keep us longer, as you mentioned?
Or we exercise.
Yeah.
Every day because we want to take care of ourselves. That's crazy. Medicine and exercise can sometimes go along very well together.
Absolutely.
Okay, good. So let's talk about that. You mentioned 6 small meals a day.
Yeah.
Okay. My poor listeners, they're so tired of me telling you this, but I recently lost 70 pounds. Not really recently. And that's how I did it. Every 3 hours, protein, real fruit, real vegetables, nothing out of a box, nothing out of a bag.
Got it.
And the protein gets your motor running.
Yes.
I love to eat. And if you eat 5 meals a day with real foods, you're full. You can't finish that 5th meal or that 6th meal because you've actually satisfied your body. It isn't as hard as people think.
You got it.
My problem was I was trying to do diets and starve myself, and I thought, forget about that. I'm just going to be a little bit heavier. But folks, 5, 6, you say 6 meals a day.
Yeah, because what I'm doing is I'm including breakfast, lunch, and dinner, and then 3 snacks.
3 snacks.
Which includes like a midnight or a bedtime snack. Okay. That's very important to regulate your sugars as well, as to have that one snack before you go to bed at night. It could be a warm glass of milk and a banana, which, by the way, increases serotonin levels in your brain, and you tend to sleep better. That's also evidence-based medicine. So,
because we're always taught, don't eat before you go to bed, because it'll go right to your hips.
Don't eat pasta and bread. Don't visit that Italian restaurant around the corner before you go to bed. So I like food, Jeannie, just like you do. They make fun of me. They're like, Dr. Matthew. I talk about food all the time, and I tell patients it's all about a balance. I'm not willing to give up a nice meal to be skinny and have washboard abs.
Right.
But I'm willing to cut back. I think that's important, is people don't think that they have to take drastic measures. Look at what you're doing now and cut back baby steps. If you eat out 3 times a week, eat out once a week. Save more money. Prepare the meals with a loved one in the kitchen. Put it in Tupperwares and take it with you, to lunch. Europeans do this all the time, and we look at them and we say, my God, they smoke, they drink. Why do they live longer than we do? Well, if you really break it down, they're more active. They bike to work.
That's true.
Yep. And they're so much more active. And a lot of Europeans do not eat out because it's so expensive. So they take their meals to work.
Well, and I think they think a lot more about what they put in their bodies.
Yeah.
We don't here. And you know what? I take that back. I think a lot of people are starting, or maybe it's just my circle because it's been a passion of mine, but I think more people are more aware of what they're putting in their bodies. But two, I get so frustrated because America puts so much into our meat and so much into our vegetables that we're already 50% behind Europe because they're cleaner in terms of the food that they produce for their citizens. But knowing that, that's why it's even more important to choose the right foods.
Absolutely. And when you eat more frequently, Jeannie, and you know this from having lost, a lot of that weight, you feel better. You eat healthy foods, you feel like the healthy foods. You breathe better, you sleep better. They're fresh,
Your brain works better.
Your brain works better.
I noticed that. I was much more on focus.
Yeah.
And really, I can tell you all day long how to do it. I also have to live it myself. And I've sort of fallen off the wagon. I find myself really hungry at night because I'm not eating enough during the day.
You got it.
And because I'm eating too much at night, the weight's kind of creeping up. And so today I have my protein drink and my orange, as you can see right in front of me, as I'm trying to get back on the bandwagon. But this is a passion of mine. Because if I can do it, honest to God, anybody can.
Absolutely.
I work constantly.
Yes.
I am a workaholic. I have a very hard time fitting in an exercise routine. I just started walking. If you're in a neighborhood with sidewalks, just walk with your kids. Talk to them after school. Fit it into your routine so that you can get that quality of time with your children, even if it's not very long. It's something. And if you're eating well, you can still lose the weight without exercising. I think it's more important what you put in your body than it is exercising to lose weight. I tell you,
Jeannie, I think it's 60-40. I think it's 60% how you eat, what you eat, and how frequently you eat, and 40% exercise. We all know people that go to gyms, and we look at them and we say, what are you doing in these gyms? Are you eating or are you working out? What's going on, Peter? And I mean, it's funny, but it's true.
It's true.
And it's because Peter goes to the gym. He loves to work out. Yeah, he might socialize a little bit more than working out, but he works out consistently. But then he goes home and he says, I've worked out. I need a pat on the back. I can eat what I want.
Yeah, that's
because
dangerous.
I worked out. That's very dangerous. So it's all about moderation. I tell people, maybe you become the weekend warrior. Monday through Friday, you're great. You're above average. I never say you're perfect. No one is perfect. But you're above average Monday through Friday. And if you have the weekends off and you're not someone who works on the weekends like I do, the weekends is your time to relax. Pat yourself on the back. Go out and have that steak dinner, but don't go crazy.
But I do, we have a lot of seniors and older adults that listen to this show. And if you're heavy, you're not always excited to exercise because it's harder to move your body. I remember.
Yes.
And so I want to implore you that you can change your eating habits to start and work the exercise plan in later when you're feeling better.
That's right.
And you're probably going to be more successful because you're going to see, hey, this is working and I'm not even exercising.
Absolutely.
And then you'll start to feel better and better and better. And then you'll start to walk. It's a step process.
You got it. Yeah. And Jeannie, also when we've talked about this briefly is if you don't eat well and you start gaining that weight, you can gain a lot of weight before you know it. And once you hit 200, 250, 300 pounds, you can still do it, but it tends to be more difficult. And then depression sets in. You mentioned how a lot of our listeners are older citizens. A lot of them probably live by themselves. They feel like they don't have enough support. They're not exercising. They're gaining weight. They may not be seeing their physician. So, once again, please, if you're that listener, there's hope. You can still lose the weight, but just like Jeannie said, it's baby steps. Clean up your diet and then think about walking.
Thank you so much. And I want to kind of pull this all back to Wellstreet because you're such a great asset to us. And I don't know that we've talked enough about all that you offer. And, you may go to the urgent care clinic because you're having an upper respiratory issue or chest pain or whatever, for whatever acute reason. Folks like Dr. Matthew and the other doctors at Wellstreet can offer so much by seeing you in that little bit of time. You're in and out in 45 minutes, but they're evaluating a whole lot of you. Do you want to talk a little bit more about that?
Of course.
Because you talked about depression and anxiety and getting them on medicine.
Right.
What I'd like you to do is talk specifically about some of the other things you're looking for while they're there that they might not realize you're looking for.
Absolutely.
And then how you work with their primary care physician to get them on a plan.
You got it. Thank you, Jeannie. So a patient that presents to Wellstreet, we look at you as a human being. We don't look at you as someone who walked in for just a sinus infection. So we're asking you questions about your past medical history, your past surgical history. What medications are you on? Are you depressed? Do you have a primary care physician? We can ask all of that as we triage you. And I look at my patient's information before I step into the room, and I have a much better idea even before shaking hands with my patients. I can tell if you're on a blood pressure medicine. I can tell if you had surgery just, a week ago. If maybe you told my nurse that you were depressed and you just mentioned that and said, oh, by the way, I'm still only here for a headache. We pay attention to details. I step into the room, I know your blood pressure, your pulse, I know your portfolio, so to speak, your health portfolio. And then what I can do as a primary care physician is not only address why you're there, but also address preventive care. And I do that, and I know all our Wellstreet physicians do that as well. And say, for instance, you have a family history of high blood pressure or diabetes. I will then say, hey, Jeannie, listen, here's the treatment for your sinus headache, but please, your blood pressure is high. Here's a primary care physician's card. I know this doctor at Piedmont. I can get you in. If you have any problems, you let me know. Oh, by the way, you mentioned you had chest pain. Let's do an EKG as well today. I know you only came in for that left ear pain. And if the EKG is abnormal, I know of cardiologists within a 5-mile radius, some of whom I play tennis with. So, we want to make sure that our patient is taken care of as a human being.
And don't take these urgent care visits lightly, because you have to fill out all that paperwork. Please fill this out before you see the doctor. So you may be realizing, oh, you know what, I did, because it forces you to think about some of the symptoms you might have had recently. And that's important because you have now a doctor looking at what's been going on with you, and they may catch things that you don't catch.
Absolutely.
And then you work with their primary care physician. You'll give them the paperwork and say, I really want you to make an appointment.
You got it.
With your primary care physician.
Yep.
Here's what you need to bring to them. I want you to highlight this and talk to them. And again, folks, he can just get you started, but you have got to take the responsibility into your own hands for your own health and follow up with that.
Absolutely. And we network with specialists. So I work in the Dunwoody location, listeners, Mount Perrin. And we are about 3 miles away from Northside, from St. Joe's. So we know all the specialists, cardiology, pediatrics. So I can be a resource for you when you come in and see me for care that you might need more than what you presented for.
That's another great point. I hadn't thought of that. So very, very important. So again, just to sort of wrap up today, we've talked a lot about preventative health. We've talked a lot about how you can help yourself manage your health so that you can lower your risk for heart disease or stroke or hypertension, how we can help you get on a regimen so that we can help you lose weight and maintain a healthy lifestyle. I promise you, if you try it, it is not as hard as it seems. Just one step at a time. Absolutely. Dr. Matthew, is there anything you want to leave the listeners with? We always run out of time. I know I've put 6 hours into a 1-hour show. But why don't you go ahead and tell them again how they can access Wellstreet? Absolutely. So just, a closing remark, take care of yourself. Guys, your body, your mind is so important. We live in a country with some of the best healthcare, some of the best physicians, some of the best technology available. Take advantage of America. Live your lives healthily, and definitely come by and see a Wellstreet physician. So wellstreet.com. I'm Dr. Matthew, and I'm the medical director at the Dunwoody location. Thanks for having me, Jeannie. Thank you so much, Dr. Matthew. I'm Jeannie Pete. Thanks for listening. Have a blessed day and week ahead. And listen here, same time next week and every week. Homestead Hope Foundation is your resource for a healthy life. God bless.